Hello friends, I am Dr. Harbansh. As you all know, I am contesting for the post of Vice President AIOS. During the course of conversation with my friends and supporters, I realized many of them are advising and guiding their family and friends due to overstressed healthcare system. My team, comprising of Dr. Ikeda Lal and Dr. Tinku Bali Razdan, will discuss with the experts to bring to you Beat the COVID series of short videos to clear all your doubts and to give you authentic, precise, and brief knowledge.
Respected seniors and my dear friends. I, Dr. Ikeda Lal, welcome you all to this series on Beat the COVID. Today, we are happy to have with us my dear friend and an expert on COVID, Dr. Jomana Hussain. She did her MD medicine from Kasturba Medical College, Manipal. After her training, she worked at Apollo Institute of Medical Sciences and Research. Currently, she is an assistant professor at Nizam's Institute of Medical Sciences in Hyderabad, where she is an integral part of their COVID managing team. She is on risk of exposure and COVID treatment guidelines committee. A very warm welcome to you, Jomana, and thank you for being with us here today.
Hi, Keda. Thanks for the opportunity.
So let's talk about how do we tackle mild COVID at home? How do we take care of patients who are isolating at home? What are the different medications we need to prescribe? And what all signs do we need to look out for? And how frequently we need to monitor these signs? So let's hear from Dr. Jomana Hussain about her treatment guidelines for mild COVID cases.
Yeah. So before we get into it, let's just talk about what mild disease is, what constitutes mild COVID. So any patient who has, fever, body ache, headache, anorexia, just some mild upper respiratory symptoms like a sore throat or a running nose, sometimes even diarrhea, it can be a symptom of COVID. These all come under just, symptomatic mild COVID. That means that they are not breathless. They're not, their oxygen levels are not low. So these patients are eligible for home isolation or home quarantine. And, once you get a call from anybody, saying that I've tested positive, I had these symptoms, the first thing that we want to ask them to do is to isolate themselves at home. So this means that, they will be staying in a separate room away from the rest of the family. The food will be brought to them at the door, preferably in disposable plates and disposable cutlery, so that it's easier and, you're not risking the rest of the families. So that's very important. And the second thing to equip them with is a pulse oximeter and a thermometer, because we need to, monitor these things for them. Then, we need to get a few baseline investigations done if it is feasible. If the patient is all right and, hemodynamically stable, I wouldn't insist on it. But ideally, if it can be done, then a complete blood picture with a differential count, because the differential count helps us in identifying the neutrophil lymphocyte ratio, because a ratio more than 3.5 is a red flag sign for us. So a complete blood picture, a random blood sugar with an HbA1c, a renal function test, a liver function test, and a complete urine examination. Just very simple, basic baseline investigations. If they have a comorbidity such as diabetes, hypertension, or any heart disease, I would recommend that they do the inflammatory markers as well. Now, let's talk about the medication. I'm sure you've seen plenty of prescriptions from various doctors. They'll always have something like azithromycin, doxy, ivermectin, a lot of multivitamins and things like that. So let's just talk about how important each of these are and what the evidence is for them and what we really want to add to our prescription. So initially, in the first wave, azithromycin was being prescribed quite a bit because that seems to be the common antibiotic for sore throat. But, now studies have demonstrated that it is not very effective and, in fact, has some cardiotoxicity. So now that drug is being avoided altogether. The next thing, we would look at is doxycycline. That is also being prescribed very commonly. According to many antimicrobial stewardship programs, doxycycline has been removed from the guidelines, but it does have some antiviral properties. It has some anti-inflammatory and immunomodulatory properties, which have been shown to be effective in patients with COVID, especially in my personal experience. So. And at the outset, I just want to say that none of these drugs is life-saving. In terms of it's not but if a patient has develops a sudden reaction or something to it, yes, you have, the authority to say that, okay, it's fine, stop the drug, because it's not really going to make that much of a difference. It's just, very little evidence here and there, which we hope will help the patient to recover. The only things that are really life-saving are steroids and anticoagulation. But anyway, when you're treating a patient at home, you do want to give them some prescription, and so doxycycline would be one of them to be added to that. And we usually give about 100 milligrams twice a day, to be taken in the morning and in the evening after a meal. We recommend that doxycycline is taken with a glass of water and to sit upright for half an hour after that, because it causes severe esophagitis and gastritis. And we prescribe it for about a week. The second drug that you might commonly be seeing on prescriptions is ivermectin. So it is an antiparasitic drug, which is extremely cheap, very easily available, has almost no side effects. And it also does have some immunomodulatory and anti-inflammatory action, which would, help patients with their immune regulation in COVID. So we prescribe about 12 milligrams of ivermectin given for about 5 days, again to be taken after a meal. If you are giving antibiotics like this, I would suggest that you add some sort of a proton pump inhibitor to your prescription, like a pantoprazole or esomeprazole, maybe with a combination of a domperidone or a levosulfuride, something to prevent gastritis, because the patients are going to be on so many medications. Now that's about the antibiotics and the proton pump inhibitor. Another thing you must be seeing very commonly on all these prescriptions are, your multivitamins. So vitamin C, vitamin D, some multivitamin with a combination of zinc. So are these really important? And, they've been labeled as these immuno boosters. And how important are they really? So the evidence in COVID is, not much, in the sense that it has not really been proven to reduce mortality. But having said that, these vitamins like vitamin C, vitamin D, and zinc, they are important components of the immune system, and they do help to maintain mucosal integrity. And if you are deficient in these, it is more likely that you will have a more severe infection, not just with coronavirus, any virus. So and they have no side effects. They're cheap, they're widely available. So there is no harm in taking these drugs. And, it's only benefit to the patient. So how do we prescribe them? The first is vitamin C, which we prescribe as an oral tablet of 500 milligrams to be taken twice a day. And you can give this for up to 2 weeks. The second would be vitamin D, which we prescribe as a tablet or a solution of 60,000 international units to be given once a week for up to 8 weeks. And the third is, a multivitamin with zinc in it. Usually it's a combination of a B complex with zinc in it. And that can be given again for 2 weeks.
Thank you, Jomana, for clearing so many doubts. So along with paracetamol, just to recap and summarize, we can, of course, give immunobooster, since there is no side effect of adding, vitamin C, vitamin D, and zinc. So if we are deficient, it will help in boosting our immunity. And we can also, that means, safely prescribe doxycycline and ivermectin. And we can be sure that if a patient has side effects, we can tell them not to stop it, although the side effects as such are very rare. So
Yes.
just a word about the favipiravir. I want to know whether, which are the cases where favipiravir is indicated, because there's been a lot of panic and again, hoarding by a lot of patients who are buying this drug, which has caused this drug to be not very easily available now these days in the middle of the second wave. So are there specific indications where you would like to prescribe this drug?
So again, I want to reiterate that, it's not a life-saving drug. It doesn't have to be prescribed to anybody. And it is difficult to procure these days, because, it's people have just bought it and kept it with them. But, if you have a patient who has, has very high spiking fever, a bit toxic, a little bit anxious, in them, there is some evidence to suggest that, using favipiravir could reduce the severity of symptoms and, maybe reduce the days of recovery. So in that sense, it might be useful. But again, the pill burden is so high. There are a lot of pills to be taken. You have to make sure that RFT, LFT, everything is normal, and monitor that. You have to monitor uric acid. So it comes with its own problems. I would only recommend it if the patient is very toxic and has high fever. But otherwise, it is not a drug that has to be given compulsorily.
Okay. So just a word about the budesonide inhalers. So now, a lot of protocols have changed, and now recently they have included either budesonide inhaler or nebulization with some kind of a steroid in their protocols. And I think some of them suggest that you should start it early as soon as the patient develops cough or fever. So, can we have some clarity regarding what are the indications and which patients you would like to start them on budesonide inhaler? Do we have some clear-cut guidelines regarding the same?
Yeah, I'm glad you brought that up, Ikeda. So yes, so there has been an article that was published in the BMJ just recently about inhaled budesonide, and they say that it does help early recovery, even in the mild stages, early stages of the illness, and inhaled budesonide can be very useful. They suggest that you use budesonide inhaler of 800 micrograms, twice a day. Now, budesonide inhalers are available as 200 or 400 micrograms. So, you would have to buy the inhaler, you would have to buy a spacer to go with it, and, then pump the appropriate number of puffs and take it in. Or you buy the Respule and give it with a nebulizer. So now, in the first wave of the pandemic, nebulizers and things like that were being discouraged because it was known as an aerosol generating procedure, where it would, then increase the chances of the virus being spread into the air and people around getting infected. But now budesonide has shown to be quite effective, and I wouldn't recommend it for everyone. But if you do have a cough, if you're feeling a little bit of chest tightness or breathlessness, especially if you have a history of asthma, then yes, using budesonide inhalers twice a day, 800 micrograms, it would be useful, and you can go ahead and use it. But you must remember that any inhalational steroid, once you have used it, you should make sure that you gargle thoroughly, because you can have a risk of developing oral candidiasis after that.
Thank you so much. So, Jomana, I would like to ask you, what are the investigations that we need to order for a patient who is in home isolation with mild COVID? What are the blood tests that we need to send to these patients?
So for these patients, Akeda, if it is feasible and only if it is possible for them, for those who have mild illness, complete blood picture with a differential count is important, because for these patients, we like to calculate what is known as the NL ratio, that is the neutrophil lymphocyte ratio. That's important because an NL ratio more than 3.5 is a red flag sign for us. So that's an important test to be done. Then, of course, a sugar with an HbA1c, an RFT, an LFT, and a complete urine examination. If the patient has comorbidities, only then inflammatory markers need to be sent. Otherwise, it's not needed. And your inflammatory markers would be your CRP, ferritin, LDH, troponin I or T. And IL-6 is an investigation which people seem to be sending for everybody, but that is not needed unless the patient has hypoxia.
All right. For highlighting all our doubts and our concerns and answering all of our questions so patiently. Thank you for taking out the time from your busy schedule and being with us here today to help us out and sort out all these queries for us. Thanks. It was lovely having you. Thank you.